I suppose this video is a little bit different, is that I'm usually saying to you why it's good to get a breast reduction. But this one is basically, why do I do breast reductions? What do I get out of it? So it is an operation that I very much enjoy doing because of the life-changing differences I see with people post-op. I've just done a clinic, 3 breast reductions that I did between 6 and 8 months ago. And I always ask, what did it mean to you to have the operation? And I see a complete difference in people. So the breast reductions went from 1 kilo in one lady, 2.2 kilos in another, and 3.5 kilo reduction. So that's heading to almost 8 pounds for a breast reduction. They all have very similar outcomes of what has happened over the last 6 months to what it has meant for them. 2 of them say they go around the house with no any bra, they don't go to bed with a bra anymore, they feel as if it's not something that is on their mind all the time. Then clothing, completely new wardrobes, dresses that they would never have worn, swimwear they would never have worn. One lady was with her grandchildren who would find very difficult to go just out swimming with them, especially if they're on holiday, and she didn't even think about it this time. There was a huge physiological input, the shoulders, the neck ache, the backache, going out and can be on your feet for hours and not worry that they feel all that ache across their shoulders. One thing I do find is that the dips in the shoulders, if the bra has been pushing on it for 20-30 years, that dip is not going to come out. But there's no redness or rawness or pain with it. It's just there's a bit now of a permanent feature. So I get this huge satisfaction of the job that I do in when patients report back to me what it has meant. And most of these have meant a huge amount. And they say, come in. One thing they say is, I should have done it earlier. The difference it's made to my life, I should have done it earlier. But sometimes that's how life is, in the sense of you're going to have your children, post-children, breast changes with menopause. One lady grew her breasts from mid-40s onwards. So there's all sorts of things that influence when the right decision is to have that operation. And it is the life point that is going to make that happen, where that decision is made. Then there's the psychological benefit, and one lady that I've just seen, she had a comment probably about 20 years ago from an inappropriate comment, always are, by a man who just couldn't stop looking at her breasts and was basically then said, you've got really big tits. I mean, what gives anybody the right to say that in the first place? But it lives with you. So then for the next 20 years, she's trying to avoid those comments by covering up, not wearing clothes that would highlight the breast. But even with that, she felt uncomfortable, always saw herself in photos. And the first thing that she saw was her breast, not her face. And this is what she thought everybody else was looking at. And this operation has changed her whole aspect. She'll be at the front having photos taken with her family. She doesn't look at those photos, she sees happy smiling faces. So this is what it means to me about what people then say to me after having this operation. So just a little bit of self-reflection here, and I'm going to share it. Okay.